Let me guess. You bought your red near infrared light panel, stood in front of it, maybe even used it every day, but you still have questions and you're not getting the results. The questions are, should I take rest days? How long am I supposed to stand here? And why are there so many different answers? Should I use oils? Or do they really block the light's benefits? How far back from the light am I? And how do I use it? Crap. Am I doing anything right? The truth is, no one really told you how to use it, not with logical precision. For starters, you were told, avoid oils. And now your skin is drying out. It's certainly not healthier. Because without the right support, light alone can actually disrupt your skin barrier. But here's what no one's telling you. The don't use oil advice is not backed by real science. And if you're not seeing the results you expected, well, it's probably because you're not using the right timing, the right oils, distance, dosage, and wavelength. This information I'm about to share unlocks a level of cellular repair that no serum, supplement, or injectable can touch. This is cellular repair from your brain to your gut, your skin to your hormones, and your joints to your hair. And did I mention your energy levels and mood? Because when you repair the mitochondria, you repair one of the most important systems in the body. No one's sharing the correct information that I'm about to share with you now. Not influencers, not skin specialists, not even functional medicine practitioners or biohackers. But I am, starting now. Subscribe, as I love sharing this trailblazing information with you, and there's so much more to come. Hi, I'm Michelle Hamel, regenerative wellness consultant, organic skincare specialist, microscopist, a clinical biohacker, and the voice behind Back to Health Today. I've spent over 20 years helping people restore mitochondrial and cellular health by working with the body, not against it. This body of yours, it's nothing short of miraculous when you give it the right tools. Now let's get to it. Let's dive into these myths and bust them. Here's what these people completely miss, and it's going to change how you think about light therapy. We're starting with the timing myth and why I don't take rest days anymore. You've probably heard this one. Take a day or two off each week. I've even mentioned that in one of my episodes. I used to believe that too, but I noticed something I didn't like. The days I skipped, my mood dipped. My energy faded, and my skin didn't have the same glow. This caused me to pause, dig even deeper into the research, and my protocols have changed. They're locked in, and they work. By the way, don't go anywhere. I'll show you exactly what I do and why it works right after we bust these myths. The next myth that we want to bust is longer sessions are better. The free radical limit, when too much light backfires. Here's something you haven't been told. There's a sweet spot for light therapy. Too short, you may not get a therapeutic dose. Too long, you risk producing too many reactive oxygen species, free radicals, right? Also known as ROS, the natural sparks released during mitochondrial activity. Here's how I explain it. ROS are like sparks from a fireplace. They trigger healing responses, regeneration, and energy. Too many, and you've got a problem. Both clinical and preclinical studies now confirm that 3 minutes per area is a sweet spot, long enough to deliver the remarkable longevity benefits without causing oxidative stress and tissue damage. Once I followed the sweet spot science, my results exploded. And now let's talk about distance. You may have heard anywhere from 4 inches to 24 inches from the light. So which is it? Let's clear the confusion. Distance matters a lot when it comes to red and near infrared light therapy. That's why I both sit and stand about 12 inches from the panel. This distance is proven to optimize penetration and power density while minimizing heat and cellular overstimulation. It also matches the columnar beam shape, which lets me treat more tissue at once. 3 clinical studies support the 12-inch range from your red near-infrared panel, delivering therapeutic power without cellular overload. And here's another important myth to expose. You can't use oils with light. A lot of people still think oils reflect the light, that they block the benefits. This myth doesn't hold up scientifically. In fact, red and near-infrared light actually open temporary pathways in the skin, enhancing delivery of our oil-based compounds. A 2001 study showed that near-infrared light enhanced the transdermal delivery of indyosin, a fat-soluble molecule, by briefly disrupting skin barrier lipids. Other research shows that red and near-infrared light, also known as photobiomodulation, temporarily opens space between the skin cells and increases the movement of larger molecules such as fatty acids into the skin. And in photodynamic light therapy, oils are used to carry antioxidants and bioactive compounds, including ingredients like methylene blue, that are driven deeper into tissue with the assistance of red and near-infrared light. And boy, you don't want to miss the benefits from methylene blue with skin care. Go back and listen to some of my previous episodes. Fantastic news. So no, oils don't block the light's healing path. Rather, countless anti-aging compounds are delivered deeper into the skin as the skin barrier opens to the light. To purchase the methylene blue I use, go to compasslaboratory.com and receive a 10% discount. Use my code Hamel, all caps. Now, let's get super clear on something most people gloss over. Red and near-infrared light are not the same thing. Red light is around 660 nanometers. It targets the surface and mid layers of skin. It supports skin glow and texture, collagen and elastin production, wound healing, mood support through increase of serotonin. It goes about 8 to 10 millimeters deep. Near-infrared light, 850 nanometers, travels deeper, up to 4 to 5 inches into our body. It activates deeper mitochondrial repair, joint tissue regeneration, brain and organ level healing, dopamine release, and even new neuron formation. Some studies even show that near-infrared penetrates the skull and triggers neurogenesis. That's right, the creation of new brain cells. That's real regeneration. Together, red and near-infrared light don't cancel each other out, but they work on different timelines. Red acts fast with a more superficial reach, targeting skin cells, blood vessels, and nerves close to the surface, while near-infrared continues to activate deeper tissue for hours after use. So when you alternate them, you're not taking a break. You're giving your body the space to apply the deeper repair near-infrared light has already set in motion. That's smart biohacking. Next in line, my complete daily protocol. Here's exactly what I do. I use Hooga HG 1500 red near-infrared light panel. You can get the Pro, but I don't think you need it. I prefer the Hooga HG, and it's very cost effective. I researched and I found that Hooga panels were the most cost-effective clinical strength I could find. I love Hooga. As the owner, one of the engineers behind the light panels actually told me their story. This group saw how overpriced the market had become and fixed it. They built a clinical-grade, affordable panel that delivers professional results for half the cost or less of their competitors. Now, here's how I use the Hooga 1500 5-light panel. I sit on a low meditation cushion about 12 inches from the panel, perfect distance to hit my upper body, core, chest, and face. I go for 3 minutes facing the light, then turn and use 3 minutes of the light on my back. Next, I stand and do the same thing for my legs. 3 in the front, 3 minutes in the back. That's only 12 minutes, and you're getting whole body light therapy. It's fast, focused, and hits everything without overexposure. And yeah, when I stand, the abdomen gets hit again. Just toss on a shirt. That's an easy fix. The distance, again, 12 inches from the panel. This gives better vertical coverage across the body due to the columnar shape of the light. It's how you can treat more tissue at one time while still staying within the therapeutic range. And remember, the research shows that sitting further away is actually healthier, reducing the risk of cellular stress while keeping you in the optimal therapeutic window. Here's my Hygge light therapy schedule. Day 1, red and near infrared light combined. Day 2, red only. Day 3, back to both. Then repeat the cycle. Want to try the same light panel I use? Go to HyggeHealth.com and use code longevity12 for 12% off. And here's my topical stack. Chlorophyll and methylene blue mist, followed by squalene MC2 or borage oil layered on top. Yes, I use oils, and as you now know, they don't block the light. By the way, you'll be happy to find my proprietary skincare strategies on my earlier skincare episodes. In conclusion, we dispelled many light therapy myths, and I shared my light therapy protocols. Happy results to you. And please, don't miss the next episode, because I'm sharing something no one's talking about. If you're using methylene blue or wish to begin using MB, this is information no one's ever shared, and you definitely need to hear it. Because what if the way you're using it is actually irritating your nervous system and causing oxidative stress? Instead of antioxidant, you're creating oxidative stress. What if that's occurring? I'll reveal brand new science showing how to pair methylene blue with red light for best results, and what might very well occur if you don't. It's surprising, and it's backed by real research. So go ahead, hit subscribe, share this with someone who needs it, and I'll see you in the next episode. And book your advanced wellness consults with me at backtohealthtoday.com. I'm not a doctor. Always consult with your healthcare provider before starting any new protocol. This is real regenerative healing, not trend-based, not surface level, but rooted in mitochondria, driven by light and elevated by science. We're not guessing anymore. The protocols are clear. The results are real. And when you work from this level, you don't just manage symptoms, you rebuild from the inside out. This is the beginning of your regeneration journey, with you on the path to real regenerative health. From the mitochondria on out. Michelle Hamel.